Top 20 Clinical Director Interview Questions and Answers. Clinical directors manage the clinical departments of organizations. They are in charge of the day-to-day administration of these entities. Part of their roles includes maintaining medical records, hiring new talents, and drafting departmental budgets. Given these essential roles, employers are always on the lookout for exceptional talents. You must convince them that you will contribute to the organization's missions, objectives, and overall goals. This article intends to make your work easier by looking at a few questions that you should expect in a clinical director's interview. Make sure that you brainstorm unique answers that will impress the interviewers. Take a look at the following. 1. Why are you interested in this position? The interviewer wants to know what made you want to become a clinical director or the reason behind your application. It would be best to treat this as a chance to sell yourself and convince the interviewer that you will be an excellent addition to the organization. Sample answer. I love helping people and ensuring that they are at their best, both mentally and physically. However, having been a nurse for quite some time, I thought I should try something more challenging such as management. I'd love to be there for the patients and help nurses and staff members in the facility to be good at their jobs. 2. What are the roles of a clinical director? Do you understand the mandates of a clinical director? What will you be doing in your new job setting if hired? This is a chance to convince the interviewer that you understand what your job entails and will quickly take up your roles in the facility. Sample answer. Clinical directors mainly manage the organization's clinical departments. They are charged with the daily administration of these units. Their tasks include sourcing and hiring new employees, preparing department budgets, and maintaining department budgets. Mention any other role that clinical directors do. 3. What are the qualities that a clinical director needs to be effective? What are some of the skills, attributes, and behaviors that make you an excellent clinical director? Your answer will determine whether you will make a good addition to the existing team of employees or not. If possible, draw from your experience and mention some of the qualities that have seen you reach this far in your career. Sample answer. The clinical director should have the same qualities as any other director in the medical field. These include personal resilience, integrity, openness, honesty, and the ability to communicate well and effectively with the other staff members, patients, and the general public. Mention any other quality that has helped you in your line of work. 4. Mention a challenge that you faced in your last role and how you overcame it. Being a key participant in the medical world is not as easy as most people think. There are several challenges in your line of work that you must overcome. Try to think about some of the main obstacles you faced in your last role and how you overcame them. Sample answer. In my former role, I was a senior nurse in a care center for the elderly. My main job was to supervise other nurses and ensure the smooth running of the clinical departments. However, we were seriously understaffed. One nurse would take care of 40 patients, which was too exhausting. I wrote to the top management, who kept promising to remedy the situation but did nothing. I would step in to help the nurses when possible. I came up with a program where we would get part-time nurses to step in and presented it to the top management as they sorted out the issue. They agreed and made the job "manageable." 5. Briefly describe your experience. The interviewer wants an overview of your career. What are some of the positions you have occupied, roles you have undertaken, or an impressive thing you have achieved in this field? Remember to keep it brief, as most of the information is captured in the resume and CV. Sample answer. I studied medicine in college and did my residency at John Belvin's Hospital and was later posted in the same institution as a junior doctor. I have managed to rise in ranks in the 15 years of my career to senior doctor, heading an entire department and team of doctors. You can mention the specifics, but do not be too wordy. 6. Mention your daily routine as a clinical director. What do you do daily in your line of work, or how do you think your day will look once you get the job? If possible, find out some of the roles that clinical directors in particular institutions perform and narrate them to the interviewer. Sample answer. I get to the workplace earlier than everyone and plan out the activities of the day. I then attend to my work emails and reply to the most urgent. I also listen to any voicemails or missed calls and reach out. I spend the rest of the day attending meetings, supervising the nurses and other medical practitioners, or traveling if scheduled. 7. Mention a strategy and mindset required for this role. Have you thought of a way of performing your duties that will guarantee you success? What are some of the strategies that you used in your former workplace? As for the right mindset, mention a guiding perspective that has always helped you succeed. Sample answer. The right strategy for a clinical director is building an environment that supports teamwork and does not compromise on delivery. This strategy also calls for a thorough selection of professionals when delegating duties. As for the right mindset, a clinical doctor should be focused on results and delivery. 8. What is the main challenge that you foresee in this position? Every job has its challenges. Whereas some are manageable, others may need the effort of a joint team to overcome. Mention a challenge that you are likely to struggle with if given this job. You can also flip the question and instead sell yourself. Sample answer. I have gone through the job description, rules, and policies and found them impressive, meaning that they won't present a problem. Back to the question, I have managed to wade through several challenges in my 15 years of experience and therefore believe that I will handle any that comes along the way. 9. How do you stay motivated in this job? How do you keep going despite this job being highly engaging and stressful? Where do you get the energy to wade through the challenges you face? Give a source of motivation that is not related to money or any material offers. Sample answer. I love helping and giving care to people, which explains why I chose this line of work. The happiness and fulfillment I see in a patient's face once they feel better convinces me to keep soaring high despite the challenges. I also reflect on my past successes whenever I feel like quitting. 10. Mention a time that you failed in this role and the lesson you learned. Can you be accountable and learn from your mistakes? To answer this question, you need to mention an experience that taught you something important. Sample answer. During my first years as a clinical director, I forgot to back up some critical information on the hospital's facilities meant for the top managers. My laptop crashed and destroyed the only available document. I had to ask for a deadline extension to gather the information once again, which disoriented me. I learned the importance of safe data practices and have adhered to them ever since. 11. Tell us about your experience in planning events. Your job as a clinical director may require you to plan events to boost community support. The interviewer, therefore, wants to know if you can do that successfully within the stipulated budget. Sample answer. I have had my fair share of experiences in planning events, both as a volunteer and in my professional work. Most events focus on common health issues affecting the community. We liaise with local businesses for donations if needed and sensitive the community on several concerns. I have managed to build lots of valuable relations in my career thanks to these events. 12. How will you balance your professional and personal schedules? The clinical director's work is highly demanding. You will mostly report to work early and work late. You may also have to take up extra projects and oversee the successful execution of community events, which means working overtime. The interviewer, therefore, wants to know if you can plan and manage your time well. Sample answer. I am a good time manager, both in my personal and professional life. I usually organize my schedule the moment I get to work, which makes me more productive. I am also highly flexible and available for instances where my services are required outside the typical workdays. I am an efficient employee, and if given a chance, I will succeed heavily in this job. 13. How do you normally handle personal issues that threaten to affect staff members and clients? Since your work mainly involves managing your organization's clinical departments, you should ensure that every employee under you is in the right mental and psychological state for productivity. Sample answer. I believe in being available and friendly to my team and staff members. I regularly interact with them for better relations and identify some of the things they may face. I also urge them to be open and ask for help whenever they feel overwhelmed. Lastly, I act as a mediator, helping them solve internal conflicts that may threaten productivity. 14. Do you believe you will make a good clinical director? This is a chance to sell yourself. Tell the interviewer what you are bringing to the table and why you believe you will succeed in this role. You can mention your skill set, experience, or anything outstanding that will make you a perfect choice for the job. However, avoid coming off as proud or arrogant. Sample answer. I am optimistic that I will make an excellent clinical director. This is my 20th year in this field, both as a private practitioner and a regular employee. I have quite an array of skills needed for this job and understand all the job-specific qualities and procedures. You are allowed to mention your skills and anything that you feel makes you the best choice out of all the possible options or the shortlisted candidates. 15. Can you tell us about a time you dealt with a situation requiring tact and sensitivity? This is a competency-based question. The interviewer is trying to unravel your experience dealing with a particular scenario. Your answer should outline the situation, how you solved it, and the final results. Also, make it as authentic as possible. Sample answer. I was once forced to switch to a new software program after a change of healthcare policies, which got some of our clients frustrated. I realized that, and I used humor, a cheerful attitude, and my interpersonal skills to remedy the situation. I managed to convince them. 16. What are some of the qualities that you look for when hiring new talents? What guides your choice of employees? Remember, one of your roles as a clinical director will be to hire new employees or scout for new talents. When answering this question, be sure to draw from your experience. Sample answer. I have quite a number of qualities that I look out for in a new employee. First, I believe that every employee should be able to collaborate with others and work in team settings, given the nature of this field. I also look for disciplined, organized, and good time managers. You can also mention other qualities that anyone working in the clinical department needs. 17. How will you handle conflicts between employees? The interviewer is testing your conflict resolution skills. You should expect conflicts in team settings, some of which may threaten team productivity. The best approach to this operational question is to give a concise and workable answer. Sample answer. The time I have spent in this field has shown me how common conflicts occur, especially when a team is involved. I have therefore had the chance to work on several conflict resolution techniques. Whenever any of my team members have a problem, I arrange a meeting to help them iron out their differences. I usually remain impartial and allow them to suggest possible solutions before assisting them in deciding on the best one. 18. How do you maintain communication between the governing boards, medical staff, and departmental heads? This question is testing your communication skills. Can you clearly pass along information about different aspects to the stakeholders and board members? Convince the interviewer of some of your effective communication techniques. Lastly, I maintain open lines of communication where anybody can feel free to pass on any message. Sample answer. I believe in regular updates. I have found out that informing people of events as they occur fosters teamwork and good relations. I also prefer personally meeting with different stakeholders when passing important information or where clarifications are needed. Lastly, I believe in maintaining open lines of communication where everybody will feel free to pass on any message. 19. Have you ever had to deal with a difficult patient? This is a competency-based question testing your interpersonal skills. Can you deal with angry patients if you ever find yourself in such a situation? Mention any experience and properly highlight the occurrences, how you managed it, and the result. Sample answer. When working as a doctor, I had a great deal of experience dealing with difficult patients. At one point, a patient couldn't let us administer first aid to him under the belief that. 20. What is your preferred management style? This is a common question that you should expect in all management positions. The interviewer wants to know how you go about your job. We advise you to carry out some research and mention a management style that accommodates the organization's goals, setting, and missions. Sample answer. I believe in a management style that supports teamwork and proper delegation of duties. I mainly focus on being a leader than a manager. I have found out that rallying people towards a common goal and mission beats telling them what to do or barking orders around. I also love an open management style where staff members or other employees will not shy away from giving a piece of their mind. This follows my love for feedback, which I believe makes me better at my job. Conclusion. These are some of the questions that you should expect in a clinical director's interview. Make sure that you have the answers at your fingertips to boost your chances of landing the job. Do not also forget to work on your interview and presentation skills.